I looked into telehealth during COVID-19, and the real question was, how do we deliver quality care to patients during a pandemic safely? Let's first look into what telehealth is. It is basically like a doctor's appointment, but from a remote platform online, using digital information and communication technologies like computers and mobile devices, and it's all to manage healthcare and a patient's health status. And in times of a lockdown during COVID, a lot of doctors did not want to see their patients physically in person unless it was absolutely necessary. But there were people who still required care, so how were we going to give them care without being in a doctor's office? It had to be implemented quickly and effectively to meet the needs of patients, but now over the phone or computer. Timeline, March 11th, 2020. We all remember this time when the World Health Organization announced a new emerging virus. COVID-19 was now a global pandemic. Following that were shutdowns and panic, and a lot of people put their health on hold, and their frequent checkups and doctor's visits were altered, but they still needed care. How do we deliver this care to those who need it, but in a safe way and not putting them at risk to the virus when necessary? So in response to COVID, states expanded telehealth and Medicaid. They made adjustments to populations, services and payment rates, technologies, and providers. We had to make sure that there were people that could use it. All types of populations were able to access Medicaid and telehealth technology. We had to make sure we had the technology necessary to work this telehealth. Providers, we had to broaden the provider types and the types of services that could be delivered via telehealth. And services and payment rates, we had to allow new services to be delivered via telehealth and adjusting the payment rates and the cost sharing. Some related issues we'll look into: success with implementation, concerns and controversies, healthcare effects, interoperability and barriers, buy-in, and future direction. Success with implementation. So it allowed for care remotely and safely during times of a pandemic. So the technology was actually around before COVID, but it wasn't used as much because people would just go into the doctor's office. But once the pandemic hit and social distancing and quarantining happened, it was implemented quickly because it was needed. It allowed for healthcare professionals to reach patients without the exposure to possible COVID cases. We wanted to keep COVID away from healthcare facilities and the professionals so they could treat more people when it was necessary. And a huge problem during COVID was the inflow of patients into hospitals, and there were hospital beds that weren't available for people who truly needed them. So using telehealth was able to reduce patient surges into hospitals and healthcare facilities, and it allowed for medical facilities to be used for those who actually needed them. So some examples and scenarios of how telehealth was used: say someone had mild symptoms, there was no reason for them to go to an emergency room, so they could schedule a telehealth call instead. Or say someone was exposed to COVID, we don't want to bring someone who could have possible COVID into a physical doctor's office, so they could use a telehealth call and explain their symptoms and exposure, and the doctor could tell them what steps to take and where to get tested next. We also want to look at people with chronic diseases. They still need these frequent visits and checkups with their doctors, but bringing them into clinics wasn't that smart because we didn't want to expose them to COVID. And also, say the provider had COVID, we obviously cannot be bringing them into their practice either because they could give their patients COVID. And say the person actually does have COVID and they're hospitalized, we should not be bringing a bunch of people in to see them. They could be doing these telehealth calls to keep people away from the exposed person. Some controversies. Obviously, people think about confidentiality, security, and safety. Is my information safe and confidential on an online platform? And from a doctor's perspective, you also have to think about, is the information I'm getting, is it truthful? Because they aren't in this physical setting anymore. So are they safe where they're at, and are they saying stuff and being prompted by people? So you also have to think about that kind of thing. And you also have to think about are people getting as quality of care as compared to like an actual doctor's visit? People are fearing that there's not going to be a provider-patient interaction anymore online, and unfortunately it was a pandemic and there was only so much doctors can do from a remote platform, but some health was better than no health. Some concerns: how will people access this technology? If people have issues with internet connection or they're unable to use it, they will not opt to telehealth visits. How can we expect older generations who don't know how to work computers well to be able to maneuver their appointments online? You've got to look into their technology literacy and the types of people that we're trying to reach. And some of these people could also have a fear of technology and would rather be in a physical setting, but it's just not as necessary or not as possible during a pandemic. And then if people don't think it's easier than going to an appointment, they're just going to opt to not do it. And we've also got to think about, are people going to have internet connections if they're remote? And how are we going to get to these people? Effects on healthcare. Healthcare loves when people take preventative services and actions towards their health. During the pandemic, a lot of people were not using their healthcare providers and put their health on hold because they didn't want to go to a doctor's appointment. But if people use telehealth, they stayed on top of their health in a pandemic. That's good for healthcare because people are still taking steps to stay healthy and on top of their health. They could detect issues earlier on, and that's way cheaper for healthcare to handle than if they actually had like an issue down the line. Some barriers: technology-related barriers. How do we make this technology, and how do we know people will be able to use it, and how do we ensure it will be accessible to everyone? Organizational barriers: how will this technology be formatted? How will users maneuver it? And we've got to think of the type of language we're using, because if it's remote, what if these people don't understand the medical terminology? And above all, it just must be user-friendly or people won't opt to use it. And then financial barriers: how are we going to fund this new technology? Because technology is expensive. We shouldn't expect patients to pay for it because they might not opt to use it if they have to pay for it. So will the providers pay for it? Some buy-in: telehealth allows for continuity of care, access to providers, reduced wait times, and especially reduced health costs, which is so important, specialty access, and preventative services. So it's an emerging and evolving technology. There are always going to be high upfront costs to any new technology, but it's an investment. Down the road, the cost will be reduced, and it is definitely worth the investment to invest in telehealth. Future direction: like I said, it's definitely worth it, and it will be staying around. It allows for personalization of healthcare, matching patients with the correct technology for them, optimal use of healthcare data, new education and communities of knowledge and practice for patients and providers, new care and business models tailored to sustainability and scalability of telehealth initiatives. How are we going to get providers to invest into it and patients to actually want to use it? And it allows for the transfer of scientific knowledge from research to implementation and practice, and innovative research methodologies within telehealth. So it's a new emerging health technology that will be staying around because we don't know how long COVID will last. And it's a really important way to reach patients beyond the office when it's not necessary. And then here's my works cited, and thank you for watching.